Hello to all of you. Today we will tell you about Crohn's disease. Let's start. What is Crohn's disease? Crohn's disease. It is a disease that is common in the small intestine and large intestine, but affects the entire digestive system from the mouth to the anus. Although there is no definite information about the cause of Crohn's disease, it is thought that the immune system, genetic and environmental factors are effective. Treatment of Crohn's disease is aimed at reducing the symptoms experienced. The disease can be controlled with drug therapy, but it is very difficult to achieve complete recovery. What are Crohn's symptoms? Symptoms of Crohn's disease. It shows symptoms such as diarrhea, abdominal pain, intestinal obstruction, loss of appetite, feeling of fullness in the intestines, fistula, rectal bleeding, ulcer, and skin inflammation. The symptom of Crohn's disease in children is growth development retardation. These symptoms may indicate thickening and ulcers in the small or large intestine. What is ulcerative colitis? Ulcerative colitis is a chronic disease that causes inflammation or sores in the large intestine and rectum. Along with genetic and environmental factors, factors such as alcohol, smoking, unhealthy diet, weak immune system, continuous drug use, and bacteria are thought to cause colitis. Symptoms of ulcerative colitis. It manifests itself with symptoms such as bloating, nausea, loss of appetite, rectal discharge, dizziness, abdominal pain, blood in the stool, and weakness. Ulcerative colitis can be treated with medication, diet, and surgery. Since it is a risky disease, colitis treatment should be followed under the control of a doctor. Untreated colitis has a high risk of developing into colon cancer. Can women with ulcerative colitis or Crohn's disease have children? Women who have had pelvic surgery for Crohn's, especially colectomy with J-cut, may have difficulty getting pregnant. However, Crohn's disease treated with other procedures does not prevent the possibility of conception. This means that women with active Crohn's disease are unlikely to become pregnant, but it is not impossible. Women planning pregnancy should realize this desire during the passive period of the disease, because the drugs used during the active period of the disease affect the course of pregnancy. Crohn's disease during pregnancy increases the risk of complications. When Crohn's disease during pregnancy is managed by a specialist doctor, you can have a healthy pregnancy. Fertility may temporarily decrease in women with ulcerative colitis. However, they can have children shortly after the treatment of colitis. How does Crohn's disease in pregnancy affect the health of the baby? Generally, women who have completed Crohn's treatment before pregnancy do not have any problems in the baby. However, Crohn's disease may reactivate during pregnancy and may have negative effects on the baby. In 15% of women whose Crohn's disease reactivates during pregnancy, there is a risk of giving birth to a premature baby. For your own health and the health of your baby, we recommend that you make pregnancy planning together with your doctor. It would be better to make a pregnancy plan according to the results of pre-pregnancy examinations and the severity of your disease. What complications does Crohn's disease cause? During pregnancy, what happens if Crohn's disease progresses? You are likely to experience pregnancy complications, even in pregnancies that start during the period when the symptoms of Crohn's disease decrease. At this point, you should cooperate with your doctor and ensure that the disease does not become active again. Crohn's disease during pregnancy can lead to complications such as miscarriage, abortion, complications during labor, and low birth weight. To prevent such complications, you should take the medicines and vitamins recommended by your doctor without interruption. Eat a healthy and regular diet. Make sure you get enough folic acid. Does pregnancy affect Crohn's symptoms? Since pregnancy affects each woman differently, it is difficult to clearly know the symptoms of Crohn's disease during pregnancy. The severity of Crohn's disease when pregnancy begins can give an idea about the symptoms you will experience during pregnancy. For example, in pregnancies that start when the disease is passive, you are unlikely to experience Crohn's symptoms during pregnancy. In some women, even if the disease is passive, Crohn's disease may recur in the first months. In pregnancies that start during the active period of the disease, the symptoms may be severe because the treatment is not fully completed. How is Crohn's disease diagnosed during pregnancy? Diagnosis of Crohn's disease before pregnancy. Blood test, gastrointestinal film, colonoscopy, biopsy, and pathology results. The techniques applied for the diagnosis of Crohn's disease during pregnancy are more limited. It is tried to be diagnosed with blood tests and ultrasound. If a clear diagnosis cannot be made, colonoscopy can be performed safely in the second trimester of pregnancy by a specialist doctor. Diagnostic procedures such as X-ray, MR, tomography should be performed after birth. Can Crohn's disease drugs be used during pregnancy? Drugs used in the treatment of Crohn's disease can be used during pregnancy, provided that your doctor approves. Your doctor may reduce or increase the dose of some medicines. Dose adjustment should be made according to the trimester of your pregnancy and the severity of your disease. Together with your doctor, you should review all the medicines you use and evaluate the risks and benefits of the medicine. Your doctor will suggest different alternatives for medicines that should not be used during pregnancy. Remember, the increase in the symptoms of the disease during pregnancy may carry more risk than the risk of the drugs you use for treatment. How should nutrition be in Crohn's disease? In order to manage the symptoms caused by Crohn's disease, a regular and balanced diet is necessary. Because Crohn's disease causes anorexia, water, vitamin, and mineral deficiency can be seen in the body. People with ulcerative colitis or Crohn's disease should not follow a strict diet. Since intestinal absorption is reduced, strict dieting can exacerbate the disease. You can manage your disease comfortably thanks to a balanced and regular diet by following the recommendations below. If the foods you eat cause you discomfort, divide your meals into small portions. Make sure to eat small portions every 3 hours. Fatty foods cause pain in the intestine. Avoid packaged foods, fried foods, and processed meats. Remove sugar from your life. Especially do not drink concentrated fruit juices. Foods in the category of milk and dairy products cause gas in the intestine. Especially when your disease is active, dairy products can exacerbate the symptoms you experience. Limit the consumption of foods that soften the intestines, as Crohn's causes diarrhea. Do not eat foods that cause gas, such as legumes, cabbage, broccoli. Make sure you drink enough fluids during the day. Do not neglect to take vitamin supplements in consultation with your doctor. Do not worry. As long as your Crohn's or colitis disease is followed by a specialist doctor, you can have a healthy pregnancy and give birth to a healthy baby. Be sure to follow the latest developments in the treatment of Crohn's disease and share your concerns and questions with your doctor. Thank you for watching.